Hi, welcome to my channel. This is Dr. Erica coming back to you with another live video. I want to talk to you today about medication overdose and also what drugs are commonly involved with medication overdoses, whether it's intentional or unintentional. I just want to talk about what to look out for, what to expect, um, how to avoid potential overdose, whether it's over-the-counter medication or prescribed medication. Also, I want to talk about rescue medication. There are rescue medications that are out there to help reverse some of the symptoms so that fatality cannot occur. So do be attentive to this video to the end, and I will go over those particular rescue medications. But I just want to start off by saying, please subscribe to this channel, like and share with your friends and family. Those who may be using multiple medications, let them know that this video is available and very helpful. I want to define the definition of overdose. It is the consumption of a quantity of a drug in excess of its recommended dosing or of a combination of drugs resulting in potential effects. There may be no symptoms or life-threatening fatality can occur and adverse effects. So the severity of overdosing depends on the patient, the person's age, the quantity of medication or amount of medication, whether there's alcohol involved, whether there's illicit meds involved. Also, the health condition of the person who's involved, and also whether the intentions are unintentional or intentional. So those are some important risk factors for the potential of overdose. Um, I want to talk about overdosing because it's very important in our society, in the States especially. There's just access to so many different medications from outside sources to inside sources. So it's a very imperative that we read prescription labels thoroughly, we read the instructions thoroughly, and we follow through as the instructions um, give way. So we do want to make sure that we are helping our elderly patients, maybe those who need more of attention with taking medications. Also, it's very important not only to read labels correctly, but understand the instructions on the label on how to take it, how frequently to take it, how many to take in a dose. That varies. How to read liquid instructions: teaspoon versus tablespoon versus um, ounces versus milliliters. So it's very important that we understand the labels on the prescription bottles, because mix-ups can happen between bottles of medication, and also there may be multiple drugs that have the same active ingredient that can cause an excess or an increase in that particular active ingredient, causing overdose and side effects. So we do want to mention that as well. So medications are very important, whether they're over the counter or they are prescribed. The only difference is one is freely accessible, and the other one is very controlled and has to go through more lawful policies and regulations. The only thing that I would say is read your labels. If you don't understand your labels, call your pharmacy or go by your pharmacy. Let the pharmacist know that you need to speak with them, and they will be happy to go over the labels with you. Okay. Now, some of the medications that are typically involved in overdosing that you may hear about or that you may see publicized are aspirin and Tylenol, and side effects of overdose or symptoms of overdose can be excessive sweating, nausea, and vomiting as well, and also liver damage and also kidney damage that could also lead to needing a organ transplant. So do be aware of that. Now, the maximum Tylenol that can be ingested is less than 4 grams in one 24-hour period. That again, that is 4 grams, less than 4 grams. Any amount greater than 4 grams can lead to liver toxicity. Okay, and there's been so much study and research about that, and it's ongoing. The topic is ongoing and also controversial. So I just make sure that if a person is going to take a cold medication that allows one small amount and another medication that's going to allow another small amount, I add the amounts together, making sure that it's less than the threshold, okay, for toxicity. So I do want to make mention of that. Okay. Then there's the opioid. Opioid or narcotics is big in this nation. We see opioid overdose all the time, especially in certain communities. But it is very imperative that I do mention that opioid therapy. That's your hydrocodone, your Norco prescriptions. These are prescription medications. Your fentanyl as well. Your amphetamine products. All of those are controlled prescription medications, and they can cause overdose when not taken correctly. Also, there are falsified tablets that are out in the black market of the fentanyl and hydrocodone tablets. So do be aware of that. If you come across anyone who may be taking fentanyl or taking an opioid medication, that they do have rescue medication with those prescriptions, okay? And I'll go over that at the end of this video. Now, the other side effect or symptom that patients may experience when taking an opioid overdose is going to be uh, drowsiness, a slowness in heart rate, a slowness in respiratory rate, also pupil change in pupil size. They call it pinpoint pupil. And then I said hypotension or a decrease in heart, the blood pressure. Okay. Now, there are some fatalities that do occur with opioid use or overdose. And before then, a patient may seem very sleepy or slow breathing to where their lungs stop functioning, and so fatality can occur. And again, there are some rescue medication that are available, and I will go over that. Next, benzodiazepine class medication is another class, a typical common class that can be used as overdose, and that's your Xanax, your lorazepam, your diazepam. Those medications, that class of medication, is typical in the black market or in use or consumption overdose. And so I want to make sure that I mention those. And the side effects of the overdose or the symptoms is very similar to the opioid class. There's a low respiratory rate, drowsiness, sleepiness, a low blood pressure or heart rate as well. Hallucinations can be there, coma, agitation, vision change, just like I mentioned with the opioids, confusion, and also, again, drowsiness is the main one side of symptom or side effect. So do be aware of that. And again, benzodiazepam is your Xanax or your alprazolam. It can be your diazepam and your lorazepam as well. So do be on the lookout for symptoms and side effects. Okay, so the medication that I did a video previously about is the naloxone. The brand name is NARCAN. Okay, this medication is used as a pump to help reverse the symptom of respiratory depression or slow breathing. So when someone is taking a benzodiazepam, they should have a box of Narcan also placed right alongside where they keep their benzodiazepam, just because in case there's an overdose, that naloxone can be used as a rescue. And then after use, the patient should be taken to the emergency department for further evaluation. But do note that there is a rescue medication on the market called Narcan. And the pro about Narcan is that not only is it a rescue medication, but also for those who cannot um, afford it economically, it is no charge, a little to no charge. Plus, there's a demonstration and a evaluation or survey that is going to be given place before the person receives the Narcan or naloxone to make sure they understand how to use it, when to use it, and how to teach family and friends how to use it in case they themselves are not able to use it during any emergency. So do be aware of that. You can speak with your healthcare provider, your prescriber, or speak with the pharmacist about getting a free box of Narcan. Again, no insurance involved, no cash involved, usually, and the pharmacist does not need a prescription from the medical doctor. So it's free, it's available, and it's open access. Okay. I have also worked in a rehab clinic to help with methadone dispensing for patients who are in recovery. That is the second rescue medication. It doesn't have to take as long, but it does take some time to recover from opioid use or opioid misuse. So I do want to encourage those out there, those persons who are interested in recovering from benzodiazepine therapy or opioid therapy, to do get involved in a counseling program, also a medication dispensing program where they can receive methadone treatment recovery. And also, not only will they receive counseling and medication, they'll also receive drug testing and all kinds of evaluation in case there's someone they need to talk to, or in case there's anything that might be going on in their life. The recovery centers are available. So check with your local health department, check with your primary care physician to find out who is available and who is offering those services in your city or state. I have had that pleasure of helping with recovery, so I do recommend recovery therapy. Okay, so if there's any questions or comments, please let me know. I'm happy to answer any questions that you may have. And I'm Dr. Erica, and I'll hope to see you on the next video. Again, like, share, and subscribe. And I am signing off. Have a good day. I hope this video is very helpful. Thank you.